With us live right now is our good friend Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital. Game 7. I was saying earlier this morning, Joe, this has been a lot of fun with these Indians. Tonight, Game 7. I'm happy it's Game 7. A lot of late nights.
That's right. For sure. No doubt about it. Being a sports fan's tough, man.
It is. Okay, this guy that everyone is in love with the Cubs, Kyle Schwarber, especially the broadcasting crews, and he's a nice, solid baseball player. Coming back from this ACL, and it's pretty quick. Injured it, I believe, the first week of the baseball season back in April, and now he's de-aging, and you can see the difference he makes in that Cubs lineup. Get into the ACLs a little bit. How difficult is this to come back this quick, and how tender is it for him right now?
Yeah, Ray, there's a lot of teaching points about ACLs related to the Kyle Schwarber thing. Everybody's asking that question. It did have an effect on this series, and even in Chicago, there was some uncertainty as they went back. Would he play in the field? And he did not, which really limited him to one pinch hitting appearance, I think, in the 3 games. So the ACL early in the year, 6 months is really early to get back. So a lot of our young people with ACLs, we see a lot of these in young athletes. So virtually every school in our region right now is dealing with some kids.
Why this, and I'm sorry to interrupt you, we hear so much advancement on a lot of these MCLs and those type of injuries where guys are coming back in 3-4 weeks. What makes the ACL different?
Oh, the ACL is such a crucial the name is cruciate ligament, such an important ligament in the middle of the knee for cutting and pivoting and turning. We started to realize that in the 1960s. And this ligament doesn't heal together on its own. And so we found out that unlike the MCL, we brace it, we rest it, we rehabilitate it, and it'll get better most of the time without surgery. The ACL, if it's torn, always needs surgery. In an athlete, it is not going to heal on its own. And you're going to be missing that ligament that gives the knee support. And so we started to do reconstructive surgery, and we've really improved that greatly in the last 30 years or so. But everybody's pushing the limits how far. So we use new tissue most of the time from the body, from the patellar tendon or the hamstring tendon, make a new ligament, a new ACL. It takes the body a while to accept that new ACL. And now we've pushed the limits in most athletes, young athletes. Really 6 months is very early, 8 months, 9 months, 12 months before you're playing again with that new ligament. Now, I asked our ACL surgeon, one of them at Children's, our chairman of orthopedics, who does a lot of ACLs, does he still limit kids when they do get back, like Schwarber was limited in this series? And we talk a lot, Ray, you and I do, about cutting and pivoting and turning being the kind of thing that would put that new ligament perhaps at some risk, and that's how you'd limit somebody. But he used a different term, which was really interesting to me, unexpected movement. So Schwarber in the batter's box may load that knee a little bit, and there's some rotational in the batter's box. And on the base paths, there's some motions that might be movement, where he has to move one side or the other, but they're expected movement. A ball is hit to him, he has to move in a way that is not expected. The knee's not quite ready to know how that load on the knee is going to be. An unexpected movement may put that ligament at risk, and so playing in the field, something that an athlete might not be able to do, running the bases, something they would be able to do, and a lot of people were curious about how would you let them bat and run the field and not. This makes good sense, and this is the same thing they do with one of our high school athletes.
Well, that's what I was saying, though. On the base pass, that can be treacherous,
too. It sure can.
As the knees, whether it's sliding or pivoting, diving back to first base. Very similar moves to playing the outfield, don't you think?
To some extent, the moves are, but I really do. I do understand a lot more so after talking to our surgeon, Dr. Kerwin Jones, is that unexpected movement. I think that's a pretty good way to explain it. And in the field, you don't know where a ball's going to go. You don't know how you have to take off over to your left side and turn and pivot and stop and start. So I do understand that. One other thing that we can learn from Schwarber, too, is you can see him on the base paths last night, Ray. He does have a brace on that knee.
Yeah.
And so that's still controversial. A lot of people say when they get back, do you make your athletes wear ACL braces? And in speaking to Dr. Jones, he does. And I would say probably more than half of the surgeons that we work with in our region that do a lot of ACLs and have become so good at it do have their athletes return in a brace that unloads some of those movements. We call it derotational, doesn't allow as much rotation or supports the knee when it goes into those rotational movements to give that new ligament, that graft, a little bit of extra support so we don't put it at risk for tearing again.
Ben Roethlisberger had some knee problems. I guess he's back and he's going to quarterback this week, but this was not ACL.
This was not ACL.
Yeah.
And cartilage is such a meniscus cartilage is so common, especially this is more an adult athlete thing. We see torn cartilage in kids, but normally together with an ACL or together with some other injury. In adults, we tear cartilage, meniscus cartilage, twisting the knee. And in this type of a situation, you can trim out the part that's torn. You can repair some of what's torn. In his case, it seems to be that they just trimmed out the part that was torn, and as quickly as he's back off a bye week, that's probably the situation. Might he pay the price someday down the road when he's playing with his grandchildren? Yeah, maybe. But for right now, he's going to be playing on Sundays for the Steelers.
All right, Joe. Thanks for coming in. Go Tribe, right?
Go Tribe. One more time tonight, Ray.
All right.
Thank
Dr.
you.
Joe Congeni, Sports Medicine Center at Akron Children's Hospital, joining us live in our studio.